All right. So without any delay, let's start with our presentation and today's topic. So today we're going to talk about speech and language issues in ASD. Let me just enlarge. I hope the screen is visible.
Yes.
Okay. So, all right, let's start with a few questions. Okay. Please read the questions on your screen and then you let me know which one do you think is which disorder, speech or language. So one case is Ram is 4-year-old. It is hard to understand him when he talks. He is quiet when he speaks and his sounds are not clear. Okay. Second, Vinay is in high school. She has had learning problems since she was young. She has trouble reading and writing and needs extra time to take tests. Mariam had a stroke. She can only say 1 or 2 words at a time. She cannot tell what she wants and needs. She also has trouble following simple instructions. Sham also had a stroke. He is able to understand everything he hears and speaks in full sentences. The problem is that he has slurred speech and is hard to understand. So those of you who have attended my previous webinars or series on language or speech, I always start with these questions because it's very important to first understand what is the difference, how we are going to segregate speech and language. So any one of you who can tell me what is the problem each person is suffering with? Who do you think is suffering from speech disorder? Who do you think is suffering from language disorder? Any inputs? No idea? We have read this much. We all know a little about speech and language. Do you want to see the screen again? Okay, is the screen visible?
Yes.
Right. So when we are talking of Ram, now what do you think is the problem? Is it speech or is it language?
It's mostly speech.
It's mostly speech. Vinay, he has trouble reading and writing.
That can be language, but it can be any other problem also. Eyesight, any.
Okay, not considering the eyesight issue, of course, but talking in terms of language and speech only. So
language.
Language. Mariam had a stroke. Now she can say 1 or 2 words.
Speech.
But okay, speech. Sham, he has a slurred speech and hard to understand.
Speech.
So now let's see what we thought and how are the problems. So Ram and Sham, they both have speech disorders, yes. Mariam has a receptive and expressive language disorder. The person who had stroke, who had trouble following simple directions. So why I talked about this thing is that we need to segregate what we understand by speech and what we understand by language. So what is speech? When we talk of speech, it is how we say sounds and words. It includes articulation, voice, and fluency. Okay, so anything that you're saying, when we say a word, what it is made up of. If I'm saying water, so I break it into syllables, water. So breaking it, making individual sounds, saying it in a particular pitch, saying the sentences with a fluency. So those 3 components are part of speech. Now, if a child is continuously able to say mama, 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 or just saying whatever you say and repeating it without thinking. So the child has speech. Okay. If he cannot progress to further sounds, if he cannot progress to further words, yes, he might be having a placement issue or articulation issue, speech sound disorder issue. But there is a difference in speech and language, as in if the child is just speaking meaninglessly, then he has speech, but he is having language issue. Language also has four components, which I'll be talking about in the future slides. So we have to understand that speech is only pertaining to these three things: articulation, voice, and fluency. How you're saying the sounds, what is the pitch, whether it is consistent or not, and what is the fluency, whether we are able to say properly or not. What is the voicing? Some kids are not able to produce enough sound to make it audible to others. So voice disorders, articulation disorders, fluency disorders, stuttering, stammering, all those things come in speech problems. So first I'll be talking about speech problems. So this is how we can classify the speech sound disorders. So under functional, which have no known causes, there are articulation disorders and phonological disorders. And organic, which are developmental or acquired, we have motor, structural, or sensory or perceptual. So sensory perceptual is like whatever input I get, in response to that, what I'm able to produce is perceptual. Okay. So if I can't hear properly, I cannot produce the sound properly. So anybody with a hearing impairment will have this organic speech sound disorder. Structural, wherever there is a structural limitation, like cleft palate or any other anomaly or any surgery or trauma which restricts the movement of the orofacial tissues. Then comes your motor. So execution and planning. Now these are also very commonly, very overly diagnosed, I'll say. So motor problems, including apraxia and dysarthria, these are different. In dysarthria, you have weakness of muscles, and apraxia, you have motor planning issues. So they can coexist together, they can coexist separately. So normally what we see is in the range of ASD, the functional, articulation, phonological, and apraxia. So these are commonly seen. Now, how do I know if my child has a speech sound disorder? The speech will not be clear. You will not be able to understand. Sound omissions. Some sounds will be missing. Sound substitutions. Some sound will be replaced by something else. For example, the child wants to say talk and he says walk. Okay. And the child sound omissions is if I want to say cat and I say cat. Sound additions, I'm adding an extra catty. Gesturing to communication. So I'm trying, but I'm not able to say. So I'll use my gestures to communicate or tell what I want. Strange pitch or volume. Sometimes you see very hoarse voice or sometimes very high pitch, shrilly kind of voice. So those come in voice disorders. So if the child is having any or one or more of these, the child will be having a speech sound disorder. Maybe mild, moderate, or severe. That is a different issue. A quick note on apraxia. So apraxia has always been a topic of interest. So just because the child is having inconsistent errors, we cannot say the child has apraxia. What happens in apraxia actually? A child only with apraxia, no associated disorder, will have very clear understanding. The receptive language will be good at par with the peers. The only problem will be he knows in his mind what he wants to say. But when it comes to execution, then he is not able to say the words. So that problem of motor planning, brain giving the instruction to your mouth that this is how you're supposed to say, this is how you're supposed to join the sounds, make the sounds and form a sentence. This planning does not happen properly. Associated things here. Now, if there is a muscle weakness associated, then we also have to add on to the strength factor. So we have to strengthen the muscles. In apraxia only, you do not have problem of muscle strength. The muscle strength is absolutely okay. But if it is an associated dysarthria or associated hypotonia or hypertonia, then you see the muscular tone issues. Apart from this, if it is associated with ASD, then you can have additional language problems. So this can get further complicated, but just because the child is not able to produce sounds, we term him, he might have apraxia. It's overly diagnosed these days, but apraxia diagnosis depends on a lot of parameters, not just because the child is not able to, he's trying and not able to produce the sound. So before you think of that, first look for other things. Now, what is language? Language refers to the words we use and how we use them to share ideas. So here comes the idea sharing thing. Whatever I say should mean something. So if I'm trying to communicate to you, I'm using language. Speech is already there, but communicating an idea to you is the usage of language. It includes what word means, how to make new words, how to put together, and what we should say at different times. So language also has different components. Okay, so speech is how we make sounds and how we produce sounds and words. And language is how we use them. What do we say? What do we say to form a sentence? How do we put together the words to form a sentence, a meaningful sentence? And what do we say in a particular context? So using the same sentence in different social scenarios will not be appropriate, right? So you have to know where to use what, how to say, whether there is a polite way of saying something, whether there is something that you shouldn't say at a particular occasion. So all those are also included in language. Language has four components: listening, speaking, writing, and reading. Okay, so any of the four, if they're hampered, the child is having language issue. So if a child cannot talk, but he can very well communicate using another device, an augmentative device, or he can type and express his feelings. So the child is only non-verbal, but has good language skills. So language, if the child does not have reading and writing, then also it is hampered. If we take only the reading and writing component, that comes in literacy. This is not language total. Language in totality has four: you listen, you speak, you read, and you write. So all the four components are incorporated when it comes to language. So coming back to my presentation, another classification of components of language is phonology, semantics, syntax, and pragmatics. So communication is anything that involves combination of ideas for sharing, for sharing ideas and for talking to each other, or for conveying what I want and understanding what the other person is saying. Now, phonology has to do only with the sound part. So this is basically the speech component. Semantics is when you use the words correctly to express a thought. So if I want to say the cat is under the chair, okay, and if I say chair, cat, under, so that is not the right way of saying it. So the child is having semantic issues. Syntax is when the child is making grammatical issues. Like I want popcorn, you want popcorn. So if you ask the child, do you want popcorn? You want popcorn. Okay, so these are a little mixed things. So you can have that echolalia there also, but syntax problems, wherever you have a grammatical problem, that refers to the syntax issue. Pragmatics is everything to do with social. I'm telling you in a simplified way. So these are like a little more technical, what is written in 50. But simply if we put it, then pragmatics has to do everything with the social things. How the child is behaving in social scenarios, what he's saying in the social thing, whether he is using it contextually appropriate, whether he is using the right way of talking, the right pitch of talking. Every social scenario thing is pragmatic. Understanding of others' feelings, expressing their own emotions, understanding the facial cues, understanding the body language, all this comes under pragmatics. Now, what are the building blocks? Now, we very quickly, whenever a child is diagnosed on the spectrum or any other developmental disorder, we just think of one thing: speech. So if the child will talk, everything will be resolved. But to talk, he needs certain prerequisites. Like before handwriting, we have those pre-writing skills. Before language, also we have the pre-language skills. If the child has those skills, there is a high possibility that he can also acquire acquire language from the environment. There is this Chomsky theory which says that we have the inbuilt system in our brains. The software is already fed in the brain by which the child can understand language. Otherwise, a 3-month-old who is obviously not talking, but he understands when you give him a social smile. Like you smile at the child and the child smiles. or the child smiles when he sees you. So those are social connects. Those are the beginning of pragmatics. Okay, the social language skills, those non-verbal communications are also included in language. They are already inbuilt in every human child as per this theory. So with that coexistence of the thing, that language can be learned or acquired. Acquired comes naturally from the environment. Learn is when we are teaching them separately. Okay. So acquiring language is difficult in case of ASD because they do not fulfill the prerequisites of what we call the pre-language skills. If we fulfill the prerequisite, then acquisition of language also starts happening. So let's see what are the pre-language skills. First and foremost, looking and listening. So the child needs to first look at you and listen to you, give you enough information, give you enough attention, as soon as a child is born, after 1 month, 2 months, he starts differentiating mother and other people. By 3, 4 months, he starts differentiating mother, father, other people in the family, smiles up at the known faces, looks probably with no expressions to new faces. So all those recognitions, analyzing everything, listening to everything, as soon as the child of a parent, the voice of the parent falls into the child's ears, they suddenly they know and they turn. Okay, so there is auditory awareness, there is auditory localization, plus there is auditory recognition and filtration of the human voices. So all these things are occurring at very, very early stages. And this skill is very important when it comes to our children. We're working very hard to develop those auditory skills. We're working very hard to develop the eye contact. So this forms one of the major pre-language skills. Then turn taking. For me to talk to you, we need to take turns. Right now, this is a webinar. But if we are making a general conversation, I say something, I wait for you to say something, then we take turns talking. So those turn taking skills are important to make a conversation. Okay. So turn taking again starts happening from very early ages. You smile at the child smiles back. You coo at the child coos back. So this reciprocal thing, imitation thing also is a part of turn taking. Smiling. So a smile, after initial few months, it becomes social smile. So the social skills start developing. If you remember in the previous webinar, Dr. Lalit mentioned about those things. So that is why we had kept the speech and language afterwards, because certain social skills are important to develop the language. We are not just talking about this is a table is made of wood, we sit on a table. No, we're talking about conversational language in a social scenario. So I'm incorporating all the components here by mentioning those things. Anticipation. Anticipation means a child sees or hears something and he anticipates that this thing is going to happen now. So the prediction of the events. This starts happening again at a very early stages. So by 3 months, a baby shows excitement at the sounds associated with different situations. So maybe if he runs a particular, if he hears a particular rattle, he shows excitement. So he anticipates, now I'm going to get the toy to play. So these anticipations, making predictions that this is going to happen, which I'm going to like. Okay, so this is also a part. The child gives you complete attention. He runs to you for that. Copying. Copying is like imitation, what we mean by copying. So imitation again is a very important skill, not just for the language, but also for our socialization. Reciprocal imitation, like we talked to and fro. So if a parent or a caregiver is doing something, the child does back. This starts by the age of 5 to 6 months nowadays. So imitation, usually if we see, we have to teach our kids. It doesn't come naturally. So imitation skills, the stronger will be your imitation skills, there is a better chance that the child can learn from the environment because he will be watching others, he will be observing others. Here also comes into play the role of observational skills with self-awareness and the environmental awareness. Then joint attention. Joint attention was explained to you by Dr. Lalit in depth. So joint attention is another important skill. Why we say read stories with the children, take a book, point to the book, make them point. This is all to develop the joint attention. Why you need to point? Why pointing is important? Pointing is just a way to get the attention at a particular thing so that you and I can focus on one particular thing. Otherwise, it's not necessary whether the child points or not. If I'm looking at that direction and you're also looking at that direction, but we don't know what we are focusing on. We're just seeing it the same direction, but we don't know the point of focus. So if I'm pointing at something and you are following that, so we make sure we are talking about one particular thing. Okay. Then understanding, of course. This is receptive skills. So understanding has to grow with age. Before the child can actually express, he needs to understand. Okay, we can teach, we can rote memorize them few words and say that they can speak before they can understand. But if the understanding comes and if you fill it, the child with the understanding of things, then it is far easier for the child to express. So when we do the analytical method, which I'll be talking about, we are actually building the receptive skills for the facilitation of the expressive skills. So how do we know if the child has problem with talking readiness or the pre-language skills? So they will have issues with eye contact. They might not have eye contact, or they might have fleeting. They might not respond to social smiles. They might not use different vocalizations and sound to indicate their different emotions. So a child as young as 4 months, 5 months can produce different types of cries to indicate whether he's hungry or he wants attention or he's sleepy. So you can start differentiating that, okay, this is what the child is feeling now. But here again, another problem comes that the children on spectrum have issues expressing and understanding emotion. So this is called electrochemia. This problem is very common. They have hard time understanding their own emotions and even difficult to understand others' emotions. So they are not able to differentiate, or they're not able to express in the right or different ways. When they're happy, they'll do the same thing. They're excited, they'll do the same thing. They're hungry, they'll do the same thing. So those differentiations are sometimes missing. They might not play with sounds or babble, so they might be having late babbling. Their imitation skills can be impaired. Their voice or gestures to get attention can be much lesser than the peers. They might not attempt to show you things or draw attention. So this joint attention, as we know, is of two types, non-social and social. So if I am showing you something, if I'm showing the child something and I get his attention, this is non-social joint attention. But if the child comes and shows me something, this is social. So the child is looking for my attention now. So those, social joint attention is where we want to reach, not the non-social. We don't need to stop at the non-social. And moving on from non-social to social takes internal motivation, which is a big, big problem. Enjoy others' participation. So they might not like if others play with them. They might be more happy with solitary play. Responding to different expressions or tones of voice. So just a high-pitched voice might mean something to them. They do not understand whether the other person is saying because he or she is disappointed or upset or tired or angry. For them, it all means the same. What are the other problems that you can see if the child is having pre-language difficulties? Behavioral issues, of course, because when the child is not able to express, there is lack of functional communication, there will be behavioral issues. Lack of play skills. So play skills are very, very important. Before we teach them to read or before we teach them to write, it's important to teach them to play. Initially, we will have to put an effort. Initially, we will have to teach those skills, and then they start becoming incidental learnings. Social skills, again, they are affected if the child is not ready. Receptive language affected, expressive affected, attention and concentration affected. So what are the things that you can do to improve these pre-language skills? Very simple things. Just play a game of peekaboo. You develop a very good eye contact, very good attention. full participation of the child. Then eye contact things. So bringing toys or items next to your face, playing fun games. We, in all the therapies and everything going on, we just forget to have fun with the child. After all, he's a child, just maybe 3, 4, 5 year old who needs to have some fun. So having fun is very, very important. You can cut down on one of the therapies, but don't cut down on the fun part. Listening to sounds. So, observing, going out and hearing different sounds and telling the child that this is that, this is the train sound, this is the whistle sound. So, all those things improve their skills, their environmental skills. Reading stories together. Just 1 second. So reading stories together, again, another very good way to develop receptive and connection, that joint attention thing. So this is one part where we develop a good joint attention, but again, prerequisites for that. Interactive game. So if the child is not sitting and playing, that's all right. Walk, move, play games that involve a lot of movement. As maximum of our kids seek sensation in one way or the other. They like sensory inputs. So use those sensory inputs, use that movement to get participation from them. Singing songs and rhymes, they like it a lot. So do those things. Play small turn taking games. Even if you're standing by a riverside, or maybe if you have a pool at home, you throw one thing, child throws one thing, you throw one thing, child throws one thing. So this is very simply taking a turn, and the child understands the concept that we go turn by turn and there is involvement of the child with it. So having said that, now let's understand what are the broadly classified communication disorders. So till now, we talked about what is speech, what is language, what are pre-language skills. Henceforth, we'll be discussing what are the communication disorders and what do I do about them. So communication disorders are mixed language, receptive expressive disorder, only expressive language disorder, speech sound disorders, which I've already discussed. Childhood onset fluency disorder is also a speech sound disorder, which is stammering or stuttering. Social communication disorders. In this one, the children have problem with the pragmatic language, and unspecified communication disorders. So they do not have a very clear clinical presentation that we can put them into under any diagnosis. So what do we do? For the speech, now I'm first talking about what do you do about the speech sound disorders. Speech sound disorders do not respond to just traditional therapy. The child is looking at you, you're looking at the child, you tell the child, say, ma, the child is not able to. This is beyond the traditional speech therapy. This is where oral placement therapy comes into picture. So a child facing any of the speech sound disorders, oral placement therapy is required for the child, oromotor therapy is required, and that is not just giving the vibrations. So who will benefit from oral placement? So any client, it does not depend on the ability or the age or the diagnosis. So it works across all ages, it works across all disorders, it works across all ability. Children who are not able to respond, if the child is seeing you that you put your tongue here or you move it like this, but still not able to. Muscle strengthening is very important thing which does not happen in traditional therapy. So those components have to be fulfilled for the child to talk or produce sounds or produce words. So children who have reduced mobility, reduced agility, reduced precision, and reduced endurance. Reduced mobility, where you do not have proper movements of the mouth muscles. Reduced agility, the speed is not as much. Reduced precision, they are not precisely keeping it. So if I want to say da, so the placement of the tongue is not very far. So precisely putting it at one point where they will produce the exact sound. And reduced endurance, the sustenance to talk. There should be enough strength in the muscles that I can sustain what I'm talking. So if I'm talking 45 minutes, I need to have enough strength, enough stability, enough grading, enough, agility in my mouth structures to do that kind of talking. So what are the goals? Awareness. We first make the child aware of what is there in the mouth, what are the different things, what are the different structures. The child might not be aware because of his sensory issues, because of hypersensitivity or hyposensitivity or mixed. So the child might not even know the distinction between his tongue and teeth. So that awareness has to be brought. The placement, how you produce different sounds, how do you combine them? How do you place your teeth? How do you place your lips? How do you place your tongue? How do you bring them together? Adequate strength, the strengthening of the muscles. Some kids are not able to, you know, blow or suck, or when they'll start talking, their initial pitch will be okay for 2 or 3 words and then it will drop. Muscle memory. So you practice the sound and the child said it good, it was good for maybe 2 days or 3 days, but then it dropped because there was not enough practice or consistency, and we did not give the child enough time to develop the muscle memory. Like we practice lifting weight 1 kg, it will be difficult initially, 7 days, 10 days, 15 days, 20 days. Then I'm okay lifting it because my body has developed enough strength to pick it up. And I just know that I have to pick it up like this. So I have developed my muscle memory. My muscle now remembers that this is what I have to do for a particular action. So my muscle, my mouth muscle also needs to know if I have to produce O sound, I need to round my lip. Or if I want to produce O sound, I need to give that much space in my jaw. So this muscle memory has to be developed. And differentiating oral movement. So I'm not going in detail for this. Now, when it comes to language, how language development happens when we talk of pre-language thing. Okay, so this pyramid will tell you how it develops. First and foremost, you get the adult-child interaction. You start getting it right from the beginning. So unless you have an involvement of the child, when we talk of build the rapport with the child, build the connection with the child, let the child be attached to you, have some interaction, have fun with him, everything is coming under this particular component. Unless the child has a rapport, why the kids are performing in therapies and not at home? Because we sometimes do not spend enough time to build that rapport with the child. And rapport is not a one-time thing that you build it and it's forever. No, you have to work, rework, rework, rework. Sometimes you do not realize and we become strict in the midways and we become too strict for the child. The child steps back. Then again, we have to analyze and rejudge that situation and work on our rapport again. So it is not a one-time thing that because I'm the mother or because I'm the father, it should happen. No, it does not happen. It has to be worked upon. Every relationship has to be worked upon. Then comes your looking and listening skills, followed by play skills, receptive language, expressive language, and finally speech. By the top of the pyramid, speech here does not mean the sound, but it means the exact correct pronunciations. So now I talked initially about language learning and language acquisition. So there are two different ways we can learn language. We can acquire, we can have language. So language learning and language acquisition. Language acquisition is passive. It happens. Learning is active. We do it. Implicit knowledge and acquisition. So whatever is going on in the environment, not focused on a particular thing, whatever is happening, whatever is being said, that the child acquires. But in learning, we get specific target based, that this is what we are going to teach. Acquisition is informal. So this is more of the naturalistic way. There are again two ways you can play with the child, the naturalistic way or the structured way. So when you're going for structured, you're going for the learning environment. When you're going for naturalistic, it goes towards acquisition. Okay. And whatever the child acquires, he usually doesn't forget. And in learning, we always move from simple to complex. Now, in ASD particularly, there is a very important thing that we need to know about language and how language is learned by the children, that is Gestalt learning pattern. So there are two ways we can learn language. We can, yes, learn out the way we are teaching it, or our kids are learning it. So ASD specifically, many of the kids are Gestalt learners and some are analytical, some are combination. Analytical is what we are doing in speech therapies, moving from simple to complex and lengthy forms. So first I'm teaching the child to say apple, then red apple, then apple is sweet, I want to eat apple, and I go on the complex things. And the total one, the child, you told the child that bring that book from the table. So the child remembered the phrase, bring that book from the table, and he will go and do that thing. But he might not know what is bring, what is book, what is table. So these learners, they first learn the language as chunks or the big pieces, and then they break it down. So analyticals are first dealing with the smaller pieces and building them together to form bigger ones. And the holistic learners or the Gestalt learners are first learning the chunks and then breaking it down and then reforming it. So we very commonly we see delayed echolalias in Gestalt. Immediate ecolalias are seen in both, but delayed echolalia is more in Gestalt learners. So this is a example where you can understand what we mean by analytic and Gestalt. So analytic may this one, the person is teaching, they want to go to park. So the child picks up the word park. When he sees the park, play park. Let's go to the park. So progression of language. And Gestalt, time for school. Let's get ready to rumble. So now this particular phrase probably came from a cartoon or maybe heard somewhere. And this he meant was that I'm ready to go. Let's get ready to eat. So he has memorized the chunk that this full sentence means that I eat. Now, if the child wants to say that I want to eat, then also the child might say, let's get ready to eat. Let's get going to park. So for these learners, it does not matter whether the whole sentence might mean just a word of it, that I want to swing in the park. So the child might be indicating towards park, the child might be indicating towards swing, the child might be indicating towards going out. So you have to actually derive the meaning of what the child is trying to say. So in his mind, he has clearly told you, or if I say wheels on the bus go round and round, that I want to go out for a car ride. So they just learn the phrases, they associate the meaning, and they put it anywhere. In their mind, they have conveyed to you what I want to say. But what it actually means might be very difficult for us sometimes. So Gestalt in actually means chunk. Okay. Here we say delayed echolalia, as I told you. And it is a style where you move from whole to memorize. So if you see this chart, Gestalt, they are memorized phrases, then they move on to mixing phrases, then single word and word combinations, and then they move to the self-generated sentences and grammar. Whereas analytic will move from single word to word combination to self-generated sentences and grammar. But analytic, if you see, is taking less time. But we should not discourage this mode of learning. So whatever the mode of learning child has, there are other learning styles, as we know, like visual or auditory or kinesthetic. So you have to work according to the learning style of the child. If the child is working in echolalias, we have to now get him, break it down, and then break to sentence structures. If the child is starting from single words, good, take it that way. So whatever is the learning style of the child, you have to work according to that. So that was in nutshell about speech and language issues in ASD. So we have speech, what we're dealing with, how to produce sounds, how to produce words, and language, which is dealing with what to say, where to say, how to say, and in social scenarios, how to say. And another important thing why I mentioned Gestalt was because we're very troubled with echolalia. Echolalia is not always bad. It is a good thing. It depends that we have to just channelize the echolalia. I might just take a webinar in future on echolalia because itself, it is a big topic. But as of now, I just want to say that echolalia is not bad. So we can channelize it and we can deconstruct it and reconstruct it. So that's about it. I'm open to any queries.
Ma'am, how long this echolalia is good? Like 3 months, 6 months, 1 year, 2 years? Before you said that we can channelize, no? So how long we can wait?
See, even if you see in neurotypicals, they are repeating your words till the age of maybe 2, 3, even 5 years. Okay, so you don't have to really wait. If you see that the child is using it to form the sentences, you just have to work around it. And if you say there is delayed echolalia, especially when the child is playing and he's just saying something scripted. Okay, that is delayed echolalia. So what we can do is, if it is in limit, the frequency is not too much, the duration is too much, the intensity is not too much. So you can let go of it. Okay. At other times, when you see the child is completely in delayed echolalia, then you have to get involved with the child and pick a word, try to get the meaning of what he's trying to say. So if I'm singing a song and I'm playing something, there must be something in my mind which is referring to, which is connecting these two things. You might be hearing certain words from the whole scripts that the child is saying. So pick those words and make connections, that what the child is trying to say. And from there, you take the conversation forward. When we're working with such kids who are very strong on echolalia, first we have to obviously go in their world, try to understand what he's trying to say, and then I give my word, and then we go on to form new sentences. So no, you don't have to wait for any age that I can let go of this thing. We have to see what is the pattern, what is the intensity, what is the frequency, what is the duration for the pitch the child is doing. And sometimes it can be simply increased because the child is having too much free time on the hand. So he will just start using echolalia as a stimming behavior.
Thank you.
Ma'am, can I
Hello.
ask?
Yes, please.
Ma'am, my question is, like, when the child is very young, like my son is around 2 years, 2 months old, and he don't have much of the receptive language, like a few words he do understand, like no,
Hmm.
and I mean the regression is still going on probably, because sometimes he learns some words and then we think that he forgot the words, not speaking but receptive language. So
Hmm.
what should we do? We generally try to make him play with us so that he feel like playing, but that is not very structured so far. He don't like very structured play because he always want his own kind of play most of the time. So how should we work on the command following or the receptive language thing as of now?
See, when you're working with very young kids, uh, we don't usually start with a structured environment. Okay, it goes in more naturalistic ways. Then you need to work on the receptive language skills for sure, and you need to work on the play skills of the child, and you need to work on the functional communication of the child, which greatly reduces the frustration levels and the behaviors of the child. So if the child wants to tell you, I want more, teach the word more. If the child wants to go up, open, out. So the power words that we need for the child to convey to us what he wants, those should be on the high priority. Then can he produce sounds? Is he able to
Yeah,
produce?
he produced sounds like ba 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 ba, ma, ma.
So not words.
Not words, but
Not
sound.
words. Okay. So you need to work on that aspect also and encourage the blends of sounds. Okay. So in the playful manner, if you are suppose playing any pouring or throwing game, so boom. So associate certain words with certain things, or the plane going zoo. So the child starts reciprocating to those sounds and starts coming up with small communicative words. So when the child comes and tells you boom, he actually means I want to play with you. Okay, so you need to give him those power words here and there and look into it. So work on the functional communication. At the same time, start as you see that the play skills are progressing, the child will start sitting. If not, then start with at least 1 to 2 minutes of any sitting thing. So we sit together and we probably stack a tower. Okay, so I'm providing a seating environment to the child, which will eventually become the zone for tabletop activities. So I'm segregating the sections, that this is my seating environment and this is my natural environment. Okay, so a chair and table separately, maybe just 2 minutes, the child will sit down and we have short activity and then we're back to our. Okay, so that you increase from 2 to 5 to 10 to 15, 20, depending upon the age and what is the tolerance of the child. So that's how you will work on it. And you need to work on both aspects. Okay, don't just work on the receptor, work on the words as a whole. Command following will happen when you will have some instructional control over the child. So that will happen once you're playing. So if the child is playing and you hold out a bowl, if the child is interested and we say put, and the child puts, put, very good, put. Then you point to something, bring. Okay, the child brings it to you. So you are starting this instruction following already in those play skills. And then you keep on increasing it because the child wants to play with you, he's interested in you. And this develops a big thing which is called motivation. Lack of motivation is one of the biggest thing why children are not coming and talking themselves. So they know a lot of words, they know a lot of sentences, they can converse, they can tell a story, they can narrate an event, but they will not come and talk to you for anything because there is no desire or motivation. So that comes from the play skills.
Thank you so much, ma'am.
Ma'am, I
एक
have a
सवाल था
question.
मेरा. हाँ जी,
Ma'am, I have a question.
let's take it one by one.
Ma'am,
Yes,
I
ma'am.
have a question.
हाँ जी.
So, my son is 2.2 years old. He communicates mostly with the single words. And at the initial of this word speaking, he has certain signs like more or all done and all that. And now he started picking the words quickly. And should we pay attention teaching the sign as well, like the gestures as well? Or only we should concentrate on teaching the words? Because some speech therapists here, they say teaching the non-verbal gestures is also important, but I come across with my BCBA where she says we slowly fade away the signs and we concentrate on the words. We don't want them to communicate with the signs. But here I have a confusion. I believe that teaching them the sign is also important uh, at the time of, like, give me. They should stretch their hand and say give me. That gestures is important, where for them to understand that give me is something they are taking, not just saying word give me. So what is
Yeah.
your opinion on that,
So
ma'am?
where are you based?
In the USA.
Okay. See, first and foremost, teaching signs, teaching gestures is different. Okay. So if I'm teaching the child gestures, acceptable, fully acceptable, and should be encouraged to a certain extent. Teaching sign language, teaching sign, I'm taking it as teaching sign language. I'm not a very big fan of it. If the child can talk at least, or we should give full attempt that the child, we have done everything to make the child talk. And if at that stage we are feeling that no, we're not getting success, yes, we will move to alternate methods. No harm in moving to that. But initially, if we provide the easier way out, just giving signs, more means or washroom. So the child sometimes does not talk. So if you're doing this, you also have to wait for the child to produce some sound or say something and then do the action. If you're just doing on this, then he will just come and this. Now here comes a role of other factors also, how interested or aware the child is, whether he has enough motivation that he comes to you and wants to have an interaction with you. So those things also matter a lot when we are taking these decisions. He's too young actually to start everything on sign. Personally, I feel, but gestures does not matter. Sometimes also we just gesture to somebody. If I'm on this session and I just gesture to my helper that close the door. Okay. So
Yeah,
this
yeah.
is
Those are
acceptable.
the gestures, I mean. Yeah, those are the
Yeah. So
gestures. Like
those
give
are
me.
acceptable.
Yeah, give me, just instead of just saying give me, we prompt hands, right? We prompt the arms, like we
Yes.
say give me. By just without the words, we just wave our hands. Those are the gestures. So
Yes.
that is also important to teach
Those
them.
are important to teach, but they should not become fixations or patterns, fixed patterns. Okay. So it's
Okay.
not necessary that every time I have to say give me. or if you do not extend your arm and say, give me, the child is not responding. So if you're introducing gestures, you also have to introduce flexibility. Okay.
Mhm.
So do that side by side, and then it will be okay. We even teach, show eating, show combing. We ask the neurotypicals also, how do you eat? Show me eating. How do you bath? Show me bathing. So
Yeah.
those are normal gestures. Teaching sign language is a different thing. Okay, so those
Yeah. No, I mean the gestures, not
no,
the
no,
sign
just
language.
don't
Yeah,
let
yeah.
them become rigid patterns, and that is
Yeah.
not.
Good evening, ma'am.
Thank you.
This is Priya
यस मैम
from
मैम
Noida.
मुझे
Hello.
सवाल पूछना था
हाँ जी, I'll first take
कृष्णा
Krishna ji's question. She was already in waiting.
यस
I'll
मैम
come to you, and Priya's question will be the last I'll be taking for the session.
Okay,
Yes,
ma'am.
यस मैम यस मैम मैम मेरा ये सवाल था मेरा बेटा 3 साल 2 महीने का है और वो जब उसकी थेरेपी स्पीच थेरेपी चल रही है और सेंसरी मतलब किया था 1 महीना हो गया है पर वहां पर जैसा सर ने सिखाया था मामा चाचा तो वो ऐसा ही बोलता है बस मामा के बाद चाचा बोलता है मुझे भी माँ नहीं बोलता है और सिंगल वर्ड ही बोलता है मतलब पापा कभी बोल दिया और कभी कभी वो अजीब से वर्ड्स और आवाजें निकालता है तो मतलब उसको मतलब कैसे अभी हम समझे कि क्या है विकी को मतलब सिर्फ सिंगल वर्ड बोलता है वो भी जब उसका मूड होता है नहीं तो नहीं बोलता वो हर चीज पानी चाहिए तो बस इशारे से ही या जाकर या बोतल उठाकर बताता है वो खाना खाना है तो भी नहीं बताता है वो ढूंढता है कुछ खाने का मिल जाए इस तरह से उन्होंने स्ट्रेटेजीज बताई कि आप उसको भूखा रखें पानी नहीं दें आप उसकी केयर नहीं करेंगी तो वो बोलेगा पर वो नहीं कर रहा है ऐसा वो
देखिए, एक लेवल तक बच्चे का फ्रस्ट्रेशन बढ़ाया जा सकता है, उसके बियॉन्ड वो बिहेवियर्स में कन्वर्ट हो जाएगा। ठीक है,
यस मैम
तो अगर अब इस स्टेज में यहाँ पे ये आ जाती है चीज कि बच्चा पहले छोटा था, उसने हल्का सा भी इशारा कर दिया, हम खुश हो गए, हमने चीज प्रोवाइड करी।
यस मैम
में होता ही है और हम करते भी हैं,
जी
बट
जी
द प्रॉब्लम हैपेंस कि वो उसी चीज पे डिपेंड हो जाता है और वो ही करता रहता है, उसके आगे वो वर्ड ही ऐड नहीं करता। अब अगर बच्चे को चाहिए मोबाइल, उसने आके मेरे को मोबाइल की तरफ इशारा कर दिया, तो यहाँ पे मैंने मोबाइल दिखाया, मोबाइल वेरी स्लोली, ओके, वेट करा कि वो करेगा, जस्ट गिव हिम एन एक्सपेक्टेड लुक, नॉट लाइक बोलो बोलो बोलो, ये नहीं, लुक दीजिए, नहीं बोला मोबाइल, मैंने सेम तरीके से 3 बार ट्राई किया, फिर भी बच्चे ने नहीं बोला, तो मैंने उसे बोला अच्छा मोबाइल को टच कर, उसने टच किया, मैंने दिया, बिना टास्क करे मैंने देना नहीं। लेकिन अगर हमारे ये अटेम्प्ट्स कम हो जाते हैं या हम बच्चे को हाईली फ्रस्ट्रेट कर देते हैं, तो वहां पे वो हमने नहीं बोलना, हम बुलवाना तो बच्चे से है, तो वहां पे अगर पूरी की पूरी डिजायर ही खत्म हो गई तो बच्चा नहीं बोलेगा।
यस मैम वो बोल नहीं रहा है, यस मैम वो बोल नहीं रहा है, वो अभी भी इशारे ही करता है, वो खुद से पानी ले लेता था अभी बीच में, अब उससे नहीं बन रहा है, हम मतलब अपने घर आ गए हैं, नानी के घर में थे, थेरेपी करा रहे थे, तो वो बोलता ही नहीं है, बस अपना ढूंढेगा कि कुछ मिल जाए खाने का, और वो अजीब से उंगली या अजीब से फोन उठाकर हेलो गुलो 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 कुछ भी अलग सा गिली कुछ भी बोलता है, वो समझ में नहीं आता है वो क्या कह रहा है।
इस प्रॉब्लम के लिए फ्रैंकली मैं आपको इस पोर्टल पे कुछ बहुत ज्यादा नहीं बता पाऊंगी, क्योंकि इसके लिए बच्चे को देखना जरूरी है।
यस मैम यस मैम,
बट
मैं दिखा देती हूँ, बच्चे को दिखा देती हूँ,
एटलीस्ट ट्राई करिए, ठीक है, दोनों चीजों को मिक्स करिए, सिर्फ जेस्चर्स में काम मत करिए, साथ में वर्ड अटैच करने शुरू कर दीजिए, और थोड़ा सा उसका फ्रस्ट्रेशन लेवल कम करिए, ताकि वो थोड़ा आप में इंटरेस्टेड हो और आपको थोड़ी अटेंशन।
हाँ, और वो जरा सी बात में गुस्सा हो जाता है, मतलब अगर उसके मन का काम नहीं हुआ, ये देखिए ये रहा, तो वो इतना ये ग्लास लेके गया, मतलब बता रहा है कि पानी पीना है, तो इतने में ही नाराज हो जाता है, ये बैठ गया, ये रहा।
मैम वही मैं आपको चीज कह रही हूँ कि सिर्फ 2-3 पॉइंट से कह पाना मुश्किल होगा कि बच्चे के सेंसरी इश्यूज क्या हैं, बाकी और प्रॉब्लम्स क्या हैं, कितना उसका इस टाइम एंजाइटी लेवल है, कितना वो बता पा रहा है, ये सारी चीजें ठीक है। तो फिलहाल के लिए अभी आप ये ट्राई करिए और धीरे धीरे थोड़ा उसके साथ खेलना ज्यादा शुरू करिए।
Good evening, ma'am.
Yes, Priya ji.
Yeah, ma'am. I'm Priya from Noida. Ma'am, my son is around 5.5 years old, and ma'am, his speech therapies are going on. He started speaking certain words now, But ma'am, some alphabets and some words he's not able to speak, like m and n. I'm like, just like you talked about that muscle memory. Like few months back, he was able to speak m and n, but now it has been faded away. Now he's not able to say pani. He will say pa. He won't be able to say mama because he's not able to say m word. So ma'am, like I just got to know about this OPT. Like, is it going to help my son if I'm going to start his OPT therapies?
Yes. Yes, it will. क्योंकि
Still,
major,
certain alphabets are there. They are still missing. He's not able to pronounce it accurately. Like,
see, that thing is also there. Plus, whenever you're teaching sound, so suppose you taught m and then you proceeded to n, and you did not do combinations and differentiation. Okay, so that time, by the child proceeds to second time sound, and the previous one is not practiced enough, he loses it.
yeah.
Okay, so those things also have to be taken care of. Plus, enough repetitions, as I mentioned, has to be given so that the child can develop that muscle memory and retain it. Even then, even after retention, when we go to 2 words or 3 words or the sentences, we have to still come back to certain sounds. Okay. So with children having articulation issues or oromotor issues, a lot of effort is required on their articulations.
Okay, ma'am, his massages with vibrating brush and like normal brush, chewy tube, it's everything going on, but still he's stuck up on pronouncing
That's
some
what
of the
I
words.
told you. That's what I
Yeah.
told you. Vibration and massages does not comprise OPT. Okay, that is a part of OPT, but vibrations are just given to everybody like that without even analyzing what is the sensory system.
So ma'am, I just wanted to ask, OPT is going to help him a lot, like to just articulate and everything.
Yes.
Okay, thank you, ma'am.
All right. Okay, thank you everybody for joining in. We are wrapping up the session now, and we'll see you on Thursday. Have a good day.
Thank you, ma'am. Thank you, ma'am.